I hate the dentist. Hated the dentist, let's say.
Want to know a secret? It's one most people don't know. Dentistry doesn't have to be painful or scary. What if you could enjoy your dental experience in complete comfort? What if you didn't have to have multiple visits or remember the sights, smells, and sounds? Millions of Americans, nearly 30%, are afraid of the dentist. They avoid dental care at all costs, even when they're in pain. They avoid the dentist for years.
It's probably been 5 years since I was at the dentist last, and I put it off until I couldn't sleep at night anymore because of the pain.
It's important to know that a visit to the dentist can be a positive experience. Modern dentistry offers safe, effective, and comfortable treatments with oral medications to anxious and fearful patients. Dental fear is a hidden phobia, the monster in the closet that no one wants to talk about. Like many people, you may be embarrassed to admit your fears and even more afraid to confront them.
I'd say it's probably been 8 years since I'd been to a dentist.
I never smiled, ever.
Dentistry I put off. I've seen a dentist maybe before I came here 4 times, maybe 3 in my life.
I was petrified of the dentist. It had been 12 years since I had seen a dentist.
Oftentimes, not even your loved ones are aware of your apprehension. Most fears develop in childhood, so odds are you've carried your dread of the dentist for years. You avoid receiving care until you're no longer able to stand the pain. When you finally seek treatment, extensive restorative work is required, which means more time in the dental chair, more procedures, and more expense. Now that cycle can be ended. Sedation dentistry is not painful or scary. Sedation dentistry uses oral medications to make you completely comfortable so the dentist and his team can work more effectively, accomplishing more dentistry in less time.
Driving along in my car and heard an ad for sedation dentistry. And I'm like, okay, that's for me. You know, something that relaxed me. You know, I could deal with the dentist. Yeah, let's try it. And I got to tell you, it was the best thing I've ever done.
Trained sedation dentists have a variety of options available to customize each patient's physiological and pharmacological needs. A number of medications that can be taken by mouth have been developed and thoroughly tested specifically for these purposes. Many help significantly reduce memory of the visit, preventing the sounds and smells from lingering in your thoughts. Here's how it works. There are just 6 simple steps to getting the smile you want and deserve. Step 1. Make your first appointment.
My biggest advice is take that first step. It takes the first step to make the phone call, to have the initial consultation on the sedation dentistry, to find out really how wonderful it can be, what a life-changing experience that it can provide.
This is difficult for many anxious people, so we make this as easy as possible. Simply call the office and the sedation team will ask you some simple questions to set up your appointment according to your wishes. They'll be happy to answer any questions you may have.
When I finally called in, the staff was very warm. They were very welcome. I was petrified to be judged about not being sent to the doctor in 12 years. I was scared that they may not want to treat me because I hadn't been in so long. I was very comforted by the staff. They were excited to see me, and I was excited to finally have an opportunity to get my dental work taken care of.
Step 2. The welcoming visit. We gather information regarding your health and discuss your preferences. If you're comfortable, we'll take x-rays and look in your mouth. But you will never be judged, disparaged, or embarrassed. Never.
Oh, the staff was great at his office. They were really, you felt like they really did care about you and were really worried about you being in pain of any kind and your comfort. So, you know, every time I've gone in there, they've been extremely, extremely nice.
It's important to talk to your dentist about your fears and concerns during your consultation before any dentistry is performed. Ask for information on your dentist's training, credentials, and the protocols they'll use prior to the appointment. It's critical that you provide your dentist with an updated health history, including any medications, vitamins, and supplements you're taking. Factors like smoking and alcohol consumption can alter the effectiveness of sedation medications, so be sure to tell your doctor about any habits you may have. Even something as seemingly insignificant as drinking grapefruit juice can have an effect on sedation, so by letting your dentist know, the right adjustments can be made.
At my dentist's office, he was very concerned. I mean, when I went in there, he would make sure that I wasn't in pain and ask frequently, and so did the staff, to make sure that I was comfortable. So, you know, I just felt like I was very much taken care of there.
Step 3. Prepare for your sedation visit. We'll usually give you a prescription for a sedative to take the night before your first appointment to guarantee a good night's sleep and to make sure you wake up relaxed. Also, you should not eat or drink 6 hours prior to your appointment unless otherwise directed by your dentist.
And for the first time, I sat in a dentist chair and didn't bust out crying, because before I would sit in a chair and the tears would start. So the sedation made a huge difference. You don't hurt, they don't start doing anything until it's fully kicked in, and you don't remember anything that happened. So if it hurt, I don't remember, and that's okay with me.
Oral sedation is a popular treatment option for many people because it does not require the use of needles. Medications can safely and effectively be swallowed whole, crushed, or delivered as a liquid. Your sedation dentist uses medications that have the safest possible ratings on the therapeutic index, making them the least likely to cause an adverse reaction.
I don't want to be awake or aware during a dental process. I don't think I'll ever get past that. But the sedation helps tremendously with it. So I don't fear the dentist anymore, at least not as long as I'm under the sedation.
Step 4. Arrive for your treatment appointment. Your companion will bring you to the office. Additional medications will be provided once you arrive to create ultimate relaxation. Your experienced sedation team will monitor you throughout your entire visit. Appropriately trained sedation dentists can perform a variety of protocols customized to your particular medical needs. The medications are safe and have been used for decades. All of these medications have amnesic properties, meaning that you remember little to nothing of your time in the dental chair. These medications give you the confidence and peace of mind to experience dental procedures in a whole new way. Hours pass like mere minutes, and more dentistry can be performed in a single, more efficient visit.
They gave me a couple of pills the night before and said, now take these an hour before. Okay. Well, I thought my appointment was for 8, so I took them at 7, and my son took me in. And they asked me how I was doing and everything, and I said, oh, fine. She says, oh, your appointment's not until 9. And I said, oops. I took the pills at 7. She goes, let's get you in. So they took me in, and they put a pillow under my legs and put a blanket on me, and the last thing I remember was when they put the bib on me. And that's all I remember until I swear it was 9 o'clock that night, but my son said, no, Mom, it was only like 3 or 4. And I went, But that was the best sleep I'd had for ages. But it was really nice.
Step 5. Go home with your new smile. Some medical conditions can affect your before and after care plans, especially if you smoke or have diabetes. So make sure your dentist knows about any medical conditions. For longer appointments, the remainder of the day should be taken off. For shorter appointments, only a half day may be necessary. Your sedation dentist will give you special eating and drinking instructions, so be sure to stay hydrated and drink lots of fluids. Your companion will need to drive you home following your appointment, and you should not drive or operate heavy machinery within 24 hours.
I've actually had every single tooth removed. Yep, and they've had they put implants in, so it was a lot of time consuming. Like I said, it's been 3 years in the making that we've gone through it, you know, and it couldn't have done it without, you know, at least being sedated when we went in. You know, I mean, this was 4 and 5, 6 hours of work at a time, you know, so to be able to be asleep when it happens surely made my life a lot better.
Well, one of my visits took about 5 or 6 hours. There was a lot of dental work that needed to be done, but the great thing is time just went by like that. And visiting with my wife, and she's like, boy, you were there a long time. I'm like, oh, really? Didn't realize that. And really wasn't sore the next day. You know, usually after sitting in the dentist office for 5 or 6 hours, your jaw would be sore and terrible. No problems.
Step 6, the day after. This final step is the most enjoyable. Most patients feel no discomfort or residual effects, nor do they remember the smells and sounds of the dental office. Most importantly, you'll be thrilled with all the compliments you'll get about your new smile.
Well, many of my friends here know that I've had a lot of dental work, and they will ask, how do you go? And I just said, I do conscious sedation. I make them make me as comfortable as they can. And I said, it's easy. It's actually very easy. I recommend it. I really recommend not knowing what happened at the dentist the next day.
So you may be wondering if you are right for sedation dentistry. I'm going to ask you a few questions. If you can say yes to any of them, then sedation dentistry is for you. Are you delaying the treatment you need or want? Are you scared, even terrified, to pick up the phone to schedule an appointment? Are you in pain, especially when you eat? Do you have trouble gagging or getting numb? Are you having trouble finding a dentist that you can trust? Do you want to smile again with confidence? Are you overwhelmed by the thought of repeated visits to the dentist? If you answered yes to any of these questions, sedation dentistry is for you. Sedation dentistry is a perfect fit for patients with high dental anxiety, a severe gag reflex, time constraints, or difficulty getting numb. If you need extensive treatment or just want to have dentistry done comfortably while you're fully relaxed, this is the answer you've been waiting for. Sedation dentistry provides a dental experience like no other. Hours seem like minutes, and recovery is a dream. The most common question patients have about sedation dentistry is just how comfortable is it?
Sedation dentistry, I tell everybody about it, especially if they say, hey, I gotta go to the dentist. It's like, go to sedation dentistry. It's no big deal. You take a pill and you're done. It's awesome.
When you're afraid, your threshold for pain is much lower. You can become hypersensitive to every sensation, prick, and noise. Fear and anxiety trigger the release of chemicals in your brain, which put your fight or flight instincts on high alert. Just the anticipation that something is going to hurt can cause you to tense all your muscles. Patients who are afraid of the dentist often experience more pain during and after their procedure. However, that can virtually be eliminated with oral sedation dentistry. It allows you to let your guard down, relax both your mind and body, and focus on feeling peaceful rather than anxious. Your apprehension and hypersensitivity to pain melts away. Just how relaxed will you be? How deep will you go? There are different levels of sedation, even with oral medications. With minimal sedation, the lightest level, you usually take a single dose on the day of your appointment to relax. To attain a longer and more comfortable experience, you may opt for moderate sedation, where protocols will be chosen for your unique needs and medical history. Sedation medications are chosen based on an individual's medical history. Many sedation dentists use sophisticated dental-specific drug interaction software that automatically cross-checks your prescriptions and any herbal and nutritional supplements with the sedatives. In addition to a thorough medical history, drug interaction screening, and patient monitoring, your insured oral sedation dentistry is completed safely and effectively.
I can tell you that you can absolutely relax and feel confident that you will be well taken care of during the process, and that you will feel differently after as well. And you really can just relax and not worry about what will happen while you're there. And sedation, I think, is probably one of the best inventions that they've made for dentistry. The more people I talk to about what I've had done, the more I'm finding out how many people there really are out there who are just absolutely petrified to go and have dental work done for various reasons. But so they consider sedation as a very good option.
Once you're completely relaxed and comfortable, your sedation dentist will be able to work quickly and efficiently to perform larger amounts of dentistry in fewer visits. And since sedation medications have an amnesic effect, you'll have very little, if any, memory of the sights, smells, or sounds of your visit, making your visit feel short and sweet. Your sedation dentist will work with you to maximize your insurance benefits and make convenient financial arrangements that will be as comfortable as sedation dentistry. Each sedation dentist makes unique arrangements and choices regarding insurance. Sedation Dentistry can help you regain your health and have the fabulous smile you've always wanted, regardless of what procedure is needed. In fact, any dental procedure can be performed while you're sedated, including repairing chips and stains with bonding or veneers, root canal, fillings, crowns, gum work, and cleanings. You can have the smile you want painlessly.
It improved my life in so many ways, appearance-wise to begin with, but I also really see the correlation between good dental health and your overall health. I realized that I wouldn't be feeling as healthy as I do now had I not gone in. And if the sedation dentistry hadn't been available, I probably wouldn't have gone back in. So it's kind of hard to say where I'd even be right now without it.
I'm so glad that I got the sedation dentistry done, because the smile that I have now is by far, it's perfect. I love it.
If you've ever been afraid to go to the dentist, you know the unbearable terror that comes with stepping foot into a dental office. You've avoided receiving treatment at any cost, and you are not alone. It's important to remember that dentistry has come a long way. Countless years of research have been dedicated to studying and finding methods to alleviate pain and anxiety. These are safe and time-tested options now available to ensure that you have a positive and painless experience. Talk to your dentist about your fears and concerns so they can better meet your needs. If you have questions not answered in this information, please write them down and bring them with you to your welcome visit. I invite you to experience dentistry like you've never experienced it before. Step out from under the shadow of fear and into the calm of sedation dentistry. You are not alone, and you no longer have to be afraid. Call today. Join the millions of people just like you and experience sedation dentistry's relaxed, easy state, where more dentistry can be accomplished in fewer visits in the most comfortable way possible. We welcome you back to dentistry. Ask our team about sedation and how it can help you get the smile you want and a healthy mouth. We invite you to experience oral sedation dentistry and enjoy your visit to the dentist.
I hate the dentist. Hated the dentist, let's say.
What changed your mind?
Sedation dentistry. Best thing since sliced bread.